Hello, my name is Andrene Thompson, and this is my social justice analysis reflection number one. And it is a response to Team Aspen, and their topic is Black inequities in Black inequities in maternal national mortality rate. And so I am responding to these questions that were posted in the module. But first, I want to say it was a great presentation. And believe it or not, all this information was new to me and shocking. uh, I was never a person that's involved in maternal care ever. It's something that I was like, no, I stay away from maternal patients. So, and I actually have a sister that's a midwife, but this whole statistics is shocking to me, especially only 20% of the OBGYNs are African American. And yeah, so this I found the presentation, it was very well put together. I like the graphics and the information was very good. It definitely will change my approach whenever I begin practicing as a nurse practitioner. So the first question I will respond to is, what did you learn in this presentation that changed you? And honestly, the entire thing was like a wake up call for me. While I do know that people died during childbirth, I really did not know that there was such a disparity for African American female. So definitely, I do not practice currently as a nurse practitioner, but I do plan to in the future. And I do not know how many maternal patients I will come in contact with, but I will definitely, whenever I do, I'm going to make it like um, a point of purpose, or one of my objectives, to make sure I talk to them about maternal care, and especially if they're during their childbearing years. Um, Definitely, for sure. Well, because I tried to do that. I know in some of my other classes, I realized that depression also was a big deal. So I tried to do that with depression. And it wasn't geared towards African American. It was really mainly geared towards young adults and stuff. So definitely I would incorporate this type of information, asking them, about their sexual uh, activity, their sexual health, and then make sure if they're again in childbearing years, if they're not taking protection, talk to them about um, maternal care and really the importance of it, because I'm not quite sure this information is out there, like how I can say we know about heart disease and diabetes. I'm not sure that this is known, that we have this wide disparity with this maternal death with African American. So this definitely was new to me. And in terms of my opinion, how does an idea in the presentation give you an idea for potential role for you as a leader in our profession in terms of advocacy or social justice? I will gear it towards advocacy because honestly, I've been really thinking about this. I've always been this legal compliance minded person. I've worked in compliance now for probably for more than 10 years. So I would like want to go into advocacy for sure. Especially, I wanted to start by joining the Nurse Practitioner Association in Oklahoma, and kind of start there and see how I can work my way into things where I can actually get my voice heard. Because I definitely, as an African American individual, I can see how I can actually contribute and help this patient population. So for sure, I can see how I can probably attend the meetings, and maybe I could try and do maybe presentation. I can probably even like just start, like, in my opinion, like start at my church, and maybe having different meetings with the young ladies there, and kind of share some information about this with them, and maybe they can, share it with their friends and their family members and so forth and so on. But the big picture is kind of getting maybe like a policy, getting the hospitals to have policy where we target this population. So for sure, for the advocacy part, I can definitely see how I can contribute. But I feel like my route in contributing in terms of advocacy would probably join in my Oklahoma Association for nurse practitioner, and then see how much I could work my way up and see how we could probably impact some of the hospitals in the state of Oklahoma. And that's going to bring me to the second question. Second part of this analysis is the new content. So I should say something different than what was said in the original presentation. So I was curious after I read the presentation. So I was curious, and I was like, I wanted to see what the statistics look like for Oklahoma versus the United States. And so I'm looking at this graph, and in 2016 we had 26 maternal death per 100,000 birth, compared to the United States. They had 20. So there was like a wide gap right there. There was six difference. In 2017, the gap did close some, and also in 2018 it did close some. I'll probably say in 2018 we were probably about 23.8, in the United States was roughly about probably around 20.8 or 21. But so we're still in Oklahoma above the national average in terms of maternal death in Oklahoma. So definitely something that we definitely need to work on. And maybe not even, I know this whole presentation was about black, but I feel like we could definitely incorporate all race, but would place maybe special emphasis on the black population. And then there was another graph that looked at mortality in Oklahoma compared to the United States. And this one does separate the blacks different from the whites. So in the black in Oklahoma, there was 52.8 deaths to 100 live birth. And then in the United States, there was 47.2. So, and then for the white, in Oklahoma is 23.2, and then in the US it was 18.1. So both races we were still higher than the nation, but there was, again, this more than 50%, because the blacks were 52.8% and the whites were 23.2. So there's still this wide gap, but I think we definitely do need to target both, with definitely special emphasis on the African Americans. And then there was also another graph that looked at the age gap, and the between age 15 to 24. In Oklahoma it was 17.3, and then in the United States it was 11. So again, there was like a deaths difference, and these are all per 100,000 live birth. And then for ages 25 to 34, in Oklahoma it was 17.7, and in the US it was 14. And then for ages 35 through 44, in Oklahoma it was 53.8, and then in the US 38.5. So again, we definitely need to work on this, and this disparity. And again, I am not an OBGYN nurse, but I can definitely see how where I could contribute in terms of advocacy. And I think my approach would more be, again, by joining the association and trying to help. So the other part of this assignment is number two, that as a social justice leader, how does the content of this analysis shape the way you communicate with others? And I think I mentioned this before, but it's more now, like, I remember when I was going through my clinical rotation, I was more geared towards, these young adults coming in with this sexual transmitted disease. I was always like open and kind of bold with them. Like, look, you know, this STI can cause all these other complications. So I feel like, and I did receive quite a few young adults. They were African, some were African American, not all, and they were pregnant. But I did not know about these statistics. Had I known about these statistics, for sure, I would be definitely encouraging them to get maternal care, and not even only encouraging them, but also telling them the reason why this is important, to make sure they get maternal care. And if anything is going wrong, they need to go to the hospital. Do not assume that do not assume that they're okay, because I think, again, some of them, they probably are afraid because of their insurance and all that stuff. But I think if they're persistent, they, at least where I'm from, I feel like if they're persistent, they will getting cared for. And hopefully, as the years roll on, we may see a decrease in the gap. I feel like, as I said before, going through the association, maybe we could, I could work and we could develop policies. Have these hospital have to develop policies that target these definite population, and try to decrease this disparity. But of course, in order to do so, we'll definitely will need to share the statistics, the research with them, so they understand the importance. And as I said, this is all brand new to me. As I said, I don't pay a lot of attention to maternal part of healthcare, and it's mainly because I always feel like I'm a chronic disease person, and I do not do maternal care. So this is important. So as I mentioned before, I do have a sister that she's a midwife. She practiced in Texas. So I'm gonna have to really talk to her about this and ask her if she was aware of the statistics, and maybe I could get her involved in advocacy also. But again, this was a great presentation. It was very informative, and thank you very much for the information.